Dr. Anwar of Southeast Texas Medical Associates is joining us today. Thank you for being here, Doctor. We appreciate it. And I understand that you don't agree with the cliche we were just talking about. You know, we've heard it a lot. What you don't know can't hurt you. Is that true?
Well, first of all, glad to be here again. No, it's not. I don't think the person who came up with that cliche was talking about healthcare. And
okay.
in terms of your health, most of the things that hurt you are the ones you don't know. So I do not agree with that at all.
And are there symptoms of things, you know, it's really a concern with healthcare, like you said, conditions where there's symptoms that people don't find out until it's almost too late. A lot of things that are happening with their bodies they don't pay attention to maybe until it's too late?
Well, absolutely. You know, I wrote an article a couple of years back known as Silent Killer that was primarily about hypertension, high blood pressure that leads to heart attacks and strokes. But we can make that stuff for diabetes, thyroid disease, HIV, and stuff like that. A lot of these things, if you do not do your routine workup, will never get picked up, and it gets picked up when you start getting signs and symptoms. And when you get signs and symptoms, half the time is already too late.
Okay, the silent symptoms are when it's too late. So really the best way to combat it is, and then of course it's hard a lot of times with, you know, being expensive, you know, people worry about health care. But if you have regular checkups like you're supposed to every year, that's what that's supposed to catch?
Absolutely. Preventive, in the olden days we used to do reactive medicine, that you only go to your doctor when you're having symptoms and he'll give you something, you'll get better. No, it doesn't hold true anymore. We live longer. So degenerative diseases are much more frequent, so preventive health care is the way to go.
And do you think that the screening and what results have been from that, how long have you been doing screenings that really help the preventative like you were mentioning?
Well, there's two parts. One is the general part that we check for cholesterol, blood pressure, you know, diabetes and what have you. And recently, like for instance, in SETMA, we're trying to help the CDC, which is the Centers for Disease Control, and TDH, which is Texas Department of Health, to find out the HIV proportion of our population. As you know, HIV is a virus that causes AIDS. And in the 1980s, it was a huge issue. Now we're trying to find out what is the exact prevalence of HIV is. Lots of people are not getting it, thinking they may have to pay for it or something. I'm here to tell everybody, if your insurance company doesn't pay for it, SETMA will pay for it.
Oh, wow.
But we really want people to know what the HIV status is. In fact, we found 2 people that have HIV did not know about it. But now we have the technology and capability for these people to have normal lives. So there's a lot to be gained by checking these things.
And a lot of people, like you said, you found that they deny the screening. They don't want to do it because they're afraid of the cost or maybe something else as well. But you're saying don't be afraid of it.
It's definitely not the cost. There's a taboo associated with it. It is your health. It's a good idea to check it. As I said, we don't like to check things that we can't fix, but these are things we can actually fix.
And you do have several offices around Southeast Texas, but if someone is interested in meeting the services, they can just give a phone call and I guess find which doctor can take them in as a patient?
Actually, we have close to 30 providers in SETMA. They can go and set up an appointment, come in and have their HIV checked, and other things for that matter. And just now we're in it to make Southeast Texas healthy, and whatever it takes, we will do.
Great, thanks. We appreciate that as always. Thank you for joining us and being a good fill-in for Dr. Hawley. We appreciate all of the good information.
Thank you.
You're welcome. Stay with us. We'll be right back. You're watching Southeast Texas Live.